Hi, and welcome to Wow Talk. My name is Donna,
And my name is Darlene.
and today we are going to talk about skin conditions. Dr. Gustin, what do we mean by that?
Well, usually it's the first thing people see when they meet you, and they'll notice whether your skin is healthy or not, and it is a huge reflection of the health on the inside, which is why naturopathic doctors treat it from the inside out. So anything that you put on topically is just a very short-lived temporary solution. And of course there are natural herbs and creams and steam facials and essential oils. Of course there are topicals. But to really truly resolve a skin condition, it's from the inside out.
Oh my, that's going to cause me to rethink skincare.
Yeah.
So why don't we start? So what would you do? I come in to see you and I don't like how my skin looks, whether it be that I'm breaking out all the time or my skin's really dry, so many different things. So why don't we just go from there?
Sure. So basically every skin condition patient that I have, the first thing my brain thinks is, do you need zinc? So skin
Really?
conditions, absolutely. So many patients are deficient in zinc, and zinc has many roles in the skin. So it is an antioxidant. It helps, prevent wrinkle formation. It helps balance the hormones. It helps with wound healing and scar tissue and digestion and immunity. So zinc has about 2,000 different roles in the body, many of which handle skin and what are called mucous membranes, your inside linings. And that's usually where I start. And it doesn't matter which skin condition. It could be eczema, psoriasis, acne. It's irrelevant. My brain first says, do you need zinc? Then I start looking at more the person as a whole. And most of the time we're referring primarily to the digestive system. And I'll joke around with my patients and tell them something really funny. And if you think about the human body, when you eat something and it goes through your digestive system, which I also call the assembly line. Mm-hmm. So it goes through the stomach and it's affected by the liver and the pancreas and then the small intestine, then the large intestine, and then all the waste comes out. So that means that there's a hollow tunnel going down the center of your body. And all of those internal linings are connected as one big sheet of inside or outside skin, just like you would look at a donut, and that the inside of the donut hole is the same sheet of food as the outside of the donut hole. So
Okay, wow.
is that profound,
yeah.
right?
Very.
So many of the skin conditions that I treat, it's the liver who is not doing a good job, whether that person needs a cleanse, or zinc, of course, does over 300 chemical reactions in the liver alone. So sometimes a person needs a detoxification of their liver. And then the second most popular thing would be that it has to do with the gut microbiome, the bug collection that you have. And all skin and mucous membranes have a different collection of which microorganisms are appropriate and healthy to be found on the skin, in the nose, in the stomach, in the mouth, etc., in the intestines.
Wow, it is like so many levels. It sounds so complicated.
Yeah.
But you know it. It seems you've got it right. You've got it down pat.
Yeah.
My goodness.
Yeah.
Wow.
Yeah. I simplify it. I everything that I hear from a patient, I put things into 3 piles. And the first pile is we collect a pile of information that pertains to get rid of things that should not be there.
Okay.
That are in your body or in your lifestyle. So get rid of parasites, get rid of dairy, get rid of gluten, get rid of toxins, whatever we find, those kind of things.
Sure.
That's the first stuff we work on, because many patients' skin conditions are aggravated by the consumption of dairy foods. So that's also something that I always say, try 1 week dairy-free, see how that goes. And then step 2 is put back whatever's missing. So that's where the zinc comes in. It could also be deficiencies of healthy oils, the essential fatty acids. It could be deficiencies of vitamin E, vitamin D, progesterone, probiotics. Put back whatever's missing. And step 3 would be heal the organs. So if you have burnout or a low thyroid, or you need to heal the skin and mucous membranes. There are different herbs usually that I'll use to heal the linings, and that's it. So every patient has their own individual reason for the skin condition. For instance, with the teenagers and their acne, the large majority of those teenagers, they have their pimples because of a buildup of a hormone called DHT. So they'll say,
Okay.
I have hormonal acne that showed up with puberty. And most doctors would think what they really meant was DHT. Well, why is DHT elevated? How about because zinc is deficient?
Okay, really?
Exactly.
Wow.
Yeah. So, so for instance, with acne, those are like small bacterial infections. Those bacteria naturally live on the surface of the skin anyway. And what happens is the conditions of the patient change, and the quality of their bloodstream is zinc deficient or acidic or extra DHT or food sensitivities. And that kind of blood is not perfectly healthy, but is an environment that over supports the bacteria that naturally live there to overpopulate themselves.
Okay.
That's why in medical doctors' offices, you'll often see them prescribing antibiotics to kill bacteria.
Oh, wow. Yes.
Right.
Like
So,
tetracycline. Wasn't that one of the ones that they used to treat years ago?
Yeah.
I remember
yeah.
that. Wow.
Yeah, so antibiotics. So it doesn't treat the root cause. So
No.
it kind of works because we're acknowledging those are small bacterial infections. But how long can you be on an antibiotic?
Exactly.
And now one of the newer trends in skincare is topical probiotics, right? And I'm always reverting back to that sequence I just mentioned. Get rid of the bad guys before you plant the good guys, and then you're done. You don't have to take products forever.
Okay. That
Yeah.
makes perfect sense. So somebody comes into your office, you suspect they are low in zinc. Now, I know that you will look at the fingernails. Maybe you can explain what you're looking for.
Sure. So when there's a significant zinc deficiency, you'll see white spots on the fingernails. And you'll see them a lot in teenagers, especially teenage boys, because they are the bottomless pit for consuming zinc. They need so much zinc for their growth, development, and testosterone that there's just not enough zinc in our food to keep up with that. And if I don't see the spots, then maybe you have a moderate zinc deficiency, and I may see that your skin tone in general is a little bit yellow, or I measure the zinc through a hair mineral analysis.
Okay, yeah.
And I'll cut the hair and mail it off to the lab. And there's one more way of assessing zinc, which is a taste test with zinc sulfate. So basically, if you do not have the ability to taste zinc sulfate as immediate, strong, and unpleasant, that can represent a deficiency of zinc nutritionally.
Okay, I remember doing that test one of the times I visited you in the past. So is there a magic number for zinc, or once again, it's the individual, and if it's moderate or if it's extreme, the deficiency,
Yep.
you then decide, because once again, we don't want to self-diagnose and prescribe and all the rest of it. We've talked about that before.
Yeah.
Yeah.
And so it will depend on age and gender and activity level. And also, sometimes I might want to get the zinc into the person's body very quickly. But if it's a patient that has low stomach acid, zinc will give them nausea. And so you can only go as fast as they can actually digest the zinc.
Okay, very, very interesting.
Yeah.
And how long does it take for you to see results, or for the patient to see results?
It's very common for them to have a significant benefit in their skin in 2 to 4 weeks. So
Amazing.
it's quite quick. And also, I always ask every patient, what's your blood type? And I will always throw that into the mix. For instance, if a person is a blood type O, the top 2 offending foods for that person would be that they're not really cut out to have a large amount of wheat or dairy. And then I'll say, suggest that they have this food plan for about a week, and that would be long enough to see that it's starting to help. But the skin has a 30-day turnover, so to have a completely fresh batch of skin that's blemish free, it's 30 days. But when you take a supplement or try a diet change, let's say a week or two, you can see that things are starting to clear up, but they're not finished yet.
Okay,
Yeah.
that's amazing. Now, what about for more mature skin that maybe you're not suffering from something like acne or oily skin? Let's say it's becoming drier, or yeah.
Sure. So that's a great contrast to bring into our talk today, because the answers are completely different. So our
Okay.
skin is very much affected by aging. At around age 40, we are less capable of replacing the collagen in our body. So a lot of patients will supplement with collagen topically or internally, and that's a very supportive thing to do. There's nothing wrong with that. And also, as we approach and pass menopause, declining estrogen levels can really affect the integrity of our skin as well.
Yes.
Everywhere, not just on our face. So there's a thinning and dryness of the skin that'll happen with less hormone levels.
Okay.
And also, what happens is one big area of skin health that we skipped over is the gut. And the gut is especially pertaining to the small intestine. This is where we have our new organ, the microbiome, and that I like people to understand what we're doing. So I translate everything. I take the big medical words and I turn them into just on the street kind of words. And I go,
That and visuals.
Yeah.
You do. You do create this picture so we can see
Yeah.
what you're talking about.
yeah. So I rebalance the belly bugs, and
Yes.
I kill the bad bugs, and I plant the good bugs. And that can also drastically benefit the skin. And all of these things that I'm saying, you could have a mix of everything. But I don't usually jump straight to food sensitivities, the IgG reactions, because sometimes I'll get patients who've had that test elsewhere and they've been told that they're allergic and sensitive to way too many foods. And then what's really going on is I'm trying to make them a less allergic person. So if wheat and dairy would give you acne 3 months ago, today, when you have replenished the zinc, rebalanced your microbiome, killed some parasites, planted some probiotics, if you had that food sensitivity test today, the list is shorter.
Okay, good.
Yeah, so there are definitely people out there who need that fingerprint blood test for IgG immune food sensitivities. And yes, it can be very related to skin conditions, especially the more autoimmune ones like psoriasis.
Okay, yes. I have vitiligo, but that's a whole other, well, not a
And
whole
that's
other thing.
autoimmune
but
too.
It's autoimmune, yes.
The root causes are all the same as well.
Yeah.
It would be all the same things. Does she have parasites? Does she need zinc? Many autoimmune conditions are known to be triggered by gluten. So,
Oh, interesting.
yeah, there's 20 times increased chance of having a gluten sensitivity if you've been diagnosed with an autoimmune disease.
Wow,
Yeah,
that gives me food for thought.
absolutely.
I need to book an appointment with you. Well, in fact, we were just talking about that. I'm a little bit overdue. I tend to think I'm having an appointment every time I see you when we do a podcast, but I'm really not. So I need to book one.
Let's do a
officially.
Donna
Yes,
series.
right. Let's do that. We should do that.
Yeah.
Absolutely. So I do have a question. Is there any benefit with taking vitamin E, like just because I feel like taking vitamin E? I've done that in the past. I think when I was pregnant, I did it each time just because I thought it's going to help during the pregnancy, the natural pregnancy, but or birth actually is what I'm talking about. However, yes, what do you think about that?
Vitamin E is a tricky one because it doesn't have very obvious symptoms when you're deficient. But it is a very common deficiency after menopause.
Okay.
So I would think of vitamin E more so after menopause And then you're also going to benefit from the other features of vitamin E, like the cardiovascular benefits.
Oh,
Exactly.
I did not know about those.
Yeah. And also with vitamin E, it's good for people who've had surgeries and injuries and scar tissue and adhesions. So I'll think of vitamin E for certain people. And there is a blood test for vitamin E that can be ordered through a private lab if you wanted to know your status of vitamin E. But realistically, if you think you sound like someone who's low in vitamin E, it's faster and cheaper to just try it for a month or two and see the response. However, I have to throw in the disclaimers always, right? Is that it is a blood thinner. So if there are patients...
It is? Oh,
it is.
Didn't know that either.
Yeah.
Okay.
Yeah, so it's a huge misconception that all these natural supplements are safe. No, there are contraindications. So if someone's on a blood thinner or someone is on blood pressure medications, the vitamin E could interact. You could have too much of a good thing if you have the blood being thinned by the vitamin E and by the prescription. So that's why it's always good to consult with a naturopath. You won't be stuck with us forever, but at least you'll be buying the right supplements and causing no harm.
And hence the warning on all of those bottles. Consult. They give you a recommended dose or what have you, but it always says consult with your health practitioner.
Of course.
And it makes sense because once again, I'll walk into a store, a health food store or a drugstore, and I'll see that whole, it looks like so many great things I should be taking. And I'm so tempted to buy bottles of all these different things. And then we have to be careful, as you say, once again.
Absolutely.
Just don't self-prescribe. Okay, well, is there anything else you would like to add when it comes to skin conditions? Do you think we need to do a part 2 and a part 3? Or
it could really branch off into any direction. I was just thinking of essential oils.
Yes.
So they're super popular right now, and there's a lot of strong products on the market that patients self-prescribe, and I would say use with caution. They were not meant to be used undiluted on the skin, and people can react to them.
Yes.
And also, they're not so safe if you get them in your eye. So if you use them on children and they rub their eye and get it into their eye, or to be ingested. So essential oils are awesome, but they also need to be used with caution.
And I'll tell you a little story about that. And I'm trying to remember if it was peppermint or lemon. I cannot remember because it was years ago, but I do remember I loved putting drops in my bath without reading about them, just because I like the smell and I love taking a bath every night. And sure enough, didn't I see, it went away, but I had all these little red spots all over my body after a certain bath, and using, as I said, it was either peppermint. I think it was peppermint. I can't remember for sure, but that's how I learned not to just throw things into water. And that's really diluted if you think about it.
Exactly.
Yeah, but that's how potent these things are.
But you drenched the body's large organ in that bathtub. So the skin, interesting fact, is the largest organ in the human body.
Yes. Thank you for bringing that up. I meant to mention that. So
it's
thank you.
It's an organ, and it's also the largest organ of detoxification.
Yes.
So people who are on any cleanse of any kind, very often part of how the toxins leave the body could be through the skin.
Yes.
And so baths can really help you draw waste out through the pores, as well as saunas and infrared saunas. So these can be very beneficial to health, to relieve the internal organs of toxicity by taking the shortcut through the sweat glands.
Wow. I think we could talk about this for hours. But what we'll do is we will revisit this topic. And especially if you will all let us know what else you would like to learn about. If you have questions, you must have questions, because I think I have a million now. I thought I had a few before, now I have a million more. So please let us know what you think. Dr. Gustin's always happy to take on new patients too. So if there's anything, any skin condition you would like some help with, by all means, look at the information in our description and make an appointment.
Thank you for listening.
Yes, thank you very much. Bye for now.
Bye.